Hi, my name is John Saxton. I'm a Professor of Clinical Exercise Physiology from Northumbria University. My research area is the role of exercise and lifestyle interventions in the prevention and management of long-term conditions, but I particularly focus on cancer and cancer survivorship. So when I think about the health benefits of exercise, I often think of a quote by Robert Salis, 2009, and you've probably seen things similar in the press, and it refers to exercise as a magic pill. You've probably seen that in the papers, and the quote says that if we had a pill that conferred all the confirmed health benefits of exercise, would we not do everything humanly possible to see to it that everyone had access to this wonder drug? Would it not be the most prescribed pill in the history of mankind? And what that quote is talking about really is the manifold health benefits of physical activity, a physically active lifestyle. And that doesn't stop at cancer. So there's quite a lot of observational evidence out there now which shows that a physically active lifestyle can help to reduce the risk of several cancers in a primary sense. So primary prevention is important, but also there's some evidence that a physically active lifestyle after treatment for early stage cancer can improve survival outcomes. There's this fairly strong evidence that exercise can reduce the risk of at least 7 cancers, including colon cancer, breast cancer, endometrial cancer, stomach cancer, bladder cancer, esophageal cancer, and kidney cancer. I think the most convincing evidence out there at the moment is for a risk-reducing effect for colon cancer and postmenopausal breast cancer in the exercise literature. The primary prevention, so certainly physical activity, exercise has an important role to play in helping prevent the onset of cancer, the development of cancer. There's a lot of evidence out there to show that. But what about beyond diagnosis and the health benefits of a physically active lifestyle after a cancer diagnosis? There was a landmark study in 2005 by Michelle Holmes that showed, it was from the Nurses' Health Study in America, and it showed that women who were physically active after treatment for early stage breast cancer had better survival than their sedentary counterparts. So in comparison with similar breast cancer survivors or patients who had been through primary treatment, been treated for early stage breast cancer, the ones who were more active had better survival outcomes. And the risk of early mortality or premature mortality was like 50% improvement. So it was a 50% improvement in survival in physically active women. And there's been other studies in colorectal cancer. There's been a couple of studies in colorectal cancer showing that in about an hour's brisk exercise or brisk walking or an hour of moderate intensity exercise a day after treatment for early stage colorectal cancer brings survival benefits. Improves survival by 50 to 60%. And then there's even a couple of studies in prostate cancer showing that prostate cancer patients or men who have been treated for prostate cancer, the more physically active they are, the better the survival after treatment for prostate cancer or during treatment for prostate cancer. And we're not talking about massive levels of exercise generally. In prostate cancer, the evidence suggests 90 minutes a week of brisk pace walking. For breast cancer, we're talking about maybe a 30-minute brisk walk on most days. It brings risk reduction of premature mortality and overall survival. Colorectal cancer seems to be a little bit more, maybe an hour of brisk walking a day for protective benefits after treatment. So what are the mechanisms then? So how might a physically active lifestyle bring benefits to cancer survivors in terms of survival? Well, there are a number of possible hypothetic mechanisms. We don't know for sure yet, but things like inflammatory mediators, improved insulin resistance, the impact exercise has on circulating estrogen levels, both in men and women, and that's important for common female and male cancers. Exercise boosts the immune function, so you get some level of boost of immune function with a physically active lifestyle, and things like oxidative stress and epigenetic changes. So there's a whole host of potential biological mechanisms which make the associations that have been observed in the observational studies plausible. The other thing to say is that weight gain and excess body fat is a risk factor for several cancers. I think in terms of primary prevention, a systematic review recently showed that excess body fat is associated with the risk of 13 specific cancers. And that's in the primary prevention sense. Now, after diagnosis, weight gain and excess body weight is also a problem and can impair survival chances. So I know in generally about 2/3 of women who are diagnosed with breast cancer are overweight or obese, and that is a problem for survival. So in comparison to their leaner counterparts, they have impaired survival or premature mortality. There's similar evidence as well in prostate cancer and in some studies in colorectal cancer that excess body fat after treatment for early stage cancers, prostate cancer, colorectal cancer, doesn't bear well for, if you have excess body fat, you have poorer survival chances in comparison to peers who have also been treated for cancer who don't have the excess body fat. So, and the reason I mention that is because physical activity and exercise has an important role to play in weight loss and weight loss maintenance. Obviously, patients need to think about diet and cutting the calories down, but in association with an exercise program, and I'll show you some evidence in a minute. Every 10 years, the World Cancer Research Fund and the American Institute for Cancer Research, they do this massive expert review of the literature. And they've come up with some key factors that are key lifestyle factors that are important for future risk of cancers. They include physical activity, being physically active, limiting the consumption of energy-dense foods and avoiding sugary drinks, eating a plant-based diet, limiting red meat, limiting alcohol intake, and also body fatness as a risk factor. Now, a study looked at this in terms of primary prevention. A study looked at risk of developing cancer in people who adhered to those guidelines, and they found that the most important factors were body fatness and alcohol intake. So they seem to be the most important lifestyle factors in this study for helping to prevent cancer. And of course, physical activity has an important role to play in relation to body fatness. Of course, all of the physiological benefits of physical activity I learned about in my training. But since I've been applying that training to work with patients, including a lot of cancer patients, and that's been sort of best part of 25 years now, I've really come to understand the psychosocial benefits of a physically active lifestyle. Things like improved anxiety, improved depression symptoms, stress management, and also a feeling that patients have been given back a sense of control. So once they've been through their primary treatment, and you prescribe them exercise or discuss a program with them and support them in that program, they feel they're doing something for themselves. It's something that they can do that's beneficial for themselves and for their future quality of survivorship. And I think the sort of the longer I'm in this field of research, the more I'm becoming aware of the role of body composition. So sometimes you don't think of body composition maybe being an important aspect of fitness. We talk about overweight and obesity, but body composition is about the amount of body fat you're containing and if you have any excess body fat, but it's also about skeletal muscle. And what we see in research studies is that a proportion of cancer patients who are overweight actually have very low levels of skeletal muscle. So they may be carrying a lot of fat, but if you do a DEXA scan or an MRI scan, you can see that their muscles have shrunk, and cancer treatments do have an adverse effect on skeletal muscle. So although body fat is an important aspect of overweight and obesity, we must also think about the skeletal muscle, because patients who are sarcopenic and who are or myopenic, have low levels of skeletal muscle, they have a worse or a poorer prognostic outcome long term. And that if they have surgery or chemo, that can exacerbate the loss of skeletal muscle. So skeletal muscle mass is very important, and that's another reason for engaging in physical activity after cancer treatment. Also, there's evidence in terms of treatments. There's a study that came out published in the Journal of Clinical Oncology, which showed that women who were undergoing chemotherapy for breast cancer had experienced benefits. So the relative dose intensity of chemotherapy was higher than in controls who didn't exercise. And the percentage of participants who received more than 85% of their planned relative dose intensity was higher in patients who exercised than those who didn't, suggesting that it's a more efficacious treatment because they're getting more of the treatment and they're able to tolerate more of that treatment. In prostate cancer, we know, and we've done work in this area, we know that androgen deprivation therapy is associated with a lot of adverse side effects, things like a decrease in skeletal muscle mass, and especially in men over 70, because after the age of 65, you start to lose skeletal muscle mass anyway. You start to lose strength and power. And if you're taking androgen deprivation therapy at the same time because of prostate cancer, then the skeletal muscle mass drops off even quicker, and there's evidence of that in the literature. So, another reason why resistance exercise and aerobic exercise and a physically active lifestyle is important for countering some of the adverse side effects of androgen deprivation therapy in men with prostate cancer, including a decline in skeletal muscle mass. They get an increase in body fat, reduced bone mineral density, and insulin resistance. And the insulin resistance and also the increased susceptibility to cardiovascular disease that comes with ADT is an important adverse side effect. And in fact, a recent study we did in Norwich showed that if you start men who are starting ADT, men with prostate cancer who are starting on ADT, if you start them on an exercise program at the same time, it ameliorates the development of these side effects, some of these side effects. So that was quite an interesting study, and I think I'd like to do more in that area. So what are the physical activity recommendations for people living with and beyond cancer? Well, the first thing is it's important to differentiate perhaps between exercise and physical activity. The two are very related terms, and in fact exercise comes under the umbrella term of physical activity, but exercise tends to mean things like structured exercise, like maybe going to the gym or a purposeful bike ride or going for a swim, or even doing exercises in your own home. But the key message is that it's exercise for its own sake. It's exercise because you're doing the exercise because it brings health benefits. So it's exercise for its own sake, and it's structured and it's planned. Physical activity, on the other hand, these days tends to mean just being more physically active in your everyday life. It might mean that you get off the bus a couple of stops earlier and walk further into work. You get into the garden more. You walk your dog. You wash the car. You actively travel to work on maybe cycle, and there's a lot of interest in this at the moment with I think there's a lot of money being ploughed into cycle lanes across cities because of COVID, so hopefully more people will start actively commuting into work. So physical activity tends to be being more physically active in your day-to-day life, and exercise or structured exercise tends to be more associated with exercise for its own sake and for the health benefits. But the recommendations for cancer survivorship is pretty similar to the Chief Medical Officer's physical activity recommendations in the UK and the international recommendations by the World Health Organization and the American College of Sport Medicine, which is 150 minutes a week of moderate intensity aerobic activity and 2 sessions of resistance exercise. I mentioned the importance of resistance exercise earlier. But also reducing sedentary time. So it is important, as I mentioned, because a lot of the research that has looked into how populations are adhering to the guidance, they forgot to look at resistance training. They've looked at the aerobic, are people doing 150 minutes? But they haven't forgot to look at the resistance exercise. And actually, if you look at all of it, then not many people are achieving that. And it might sound daunting to a person who's been through cancer to think, I've got to do 150 minutes a week, but you don't have to. I mean, that's the guidance, that's the optimal minimum, if you like, but you can work up to that, and patients should work up to that, because anything, the latest guidance shows that anything is actually better than nothing. So even low intensity, if you substitute low intensity physical activity, which is not brisk, it's not brisk walking, it's low intensity walking about, it's just being more generally active. If you substitute some of your sitting time with that, then that also brings long-term health benefits. So it's small steps, but ideally, if people can work up to 30 minutes a day on say a 30-minute purposeful brisk walk on 5 days a week, then that would be fantastic, and that's in line with the guidance. I mentioned resistance exercise. And people can do resistance exercise in their own homes these days using TheraBands, and there are lots of videos out there showing how to do TheraBand exercise. So it's quite an easy, and we've just recently completed a study at Northumbria with prostate cancer guys who'd had surgery. So these were surgical prostate cancer patients, and we prescribed them a home-based resistance training program with TheraBands 2 or 3 times a week, and we supported them with telephone calls, and we taught them how to do the exercises, and that actually was very successful. We saw a lot of health benefits resulting from home-based resistance exercise in prostate cancer patients. I've mentioned the negative impact of sedentary time, so there is some evidence. I think at least 3 cancers have been linked to high levels of sitting behaviour. So there's a lot of interest in how long we sit down now in our jobs, in our leisure time, watching TV, that kind of thing, and this is often controlled. So they control for physical activity in these things. So even if you are achieving maybe doing 150 minutes of moderate, but you're sitting down for 8 hours a day, it's a problem. It's still a problem. It's an independent risk factor. So we need to break up the sedentary time, even if we are achieving 150 minutes. That's the message that's coming out of the literature. And that is true for people who've had cancer as well. So in terms of planning to exercise, there are a few sort of tips that we try and engage patients in. And the first thing is to plan to exercise and to set goals. So the first thing is to make a list and think about the activities you enjoy doing, or what activities you're willing to try. So that's important, because enjoyment it always improves adherence to some new behaviour. We know that social support is important. Now that's a challenge at the moment because we have the COVID social distancing measures in place. But we're now looking at ways to use video conferencing to provide and to lead exercise sessions and to lead discussion sessions amongst different patients using real-time video conferencing. And there's a lot of interest in that at the moment. Now, whether that can actually, the extent to which that compares with being face-to-face, we don't know yet. And I guess it will always be second best. But it's probably better than not having any attempt to provide that social support, because social support is important for adherence to a physically active lifestyle. So we try and get people to buddy up, or to get their spouses or partners involved, or the children, and do it that way, and that aids long-term adherence. So questions like, who could support you in your goal to become physically active? Can you identify an exercise companion, someone to exercise with? And also making a diary each week and setting short-term goals. I mentioned the 150 minutes a week, but things like at the end of the first month, I want to be walking at least 10 minutes a day, 3 days a week. At the end of the third month, I want to be walking at least 30 minutes a day, 3 days a week. Then it might take 6 months to get up to sort of 30 minutes a day on 5 days a week. That's fine. That's a gradual process, because and also often the lower down you start, the more sedentary you start, the more you notice the improved fitness as you start to become more physically active. Just a couple of more things to say is, I know a lot of women who've been treated for breast cancer have lymphedema, and they do have concerns and anxieties about exercising with lymphedema. But the evidence now is saying that there is no real main problem exercising with lymphedema. You may, wear the sleeve. Also, you perhaps using gravity for arm exercise, shoulder mobility exercises, but nice guidance is actually does encourage even women with lymphedema to be physically active as well. So again, that's a concern, but it shouldn't be. And there may be some contraindications to some exercises, but it shouldn't be a major concern for women with lymphedema to continue to exercise and get the benefits of exercise. Even bone metastases, there was a large systematic review last year, and I think there's a booklet by Macmillan out there as well now, showing, I've got the reference somewhere, but so the general message is to follow the same guidance as for all cancer survivors, but obviously, if possible, Mirrors classification is recommended to determine relative fracture risk potentially, and also to be aware of pain. So a pain assessment may be necessary for some patients to guide specific exercise contraindications. So weight-bearing bone pain is an issue that you shouldn't be doing weight-bearing exercise. So those are key issues to take into account. But generally, patients with bone metastases can and have been shown to exhibit a lot of health improvements and health benefits from being physically active.